Off, if you live in a rural area, you are nearly 20% more likely to develop heart failure, according to the National Institutes of Health. Getting help fast is critical, and a new cardiac lab at Mercy Ada is working to provide that help.
News 12's Caroline Cluess-Fletcher tells us how many lives have been saved since they opened last month.
We have a saying that time is muscle.
Dr. Payman Sattar says when someone has a heart attack, it's a race against time to get blood back to the heart. Previously, heart attack patients would have to be flown or driven to Oklahoma City for life-saving cardiac interventions. But by opening the new cath lab,
typically we're done by the time the patient would get over there. So we're trying to minimize the amount of time that the heart muscle is not receiving blood flow and oxygen.
Don't delay care. See your physician if you have any of the symptoms of chest pain.
President Terrence Farrell says while many rural hospitals around the country are struggling, Mercy Ada is expanding their cardiac programs.
About 250,000 people really are affected by the availability of this service. We want to be the best. We want everybody who walks through this door to receive the very best care they could receive anywhere.
The lab's first patient came from the ER.
We were able to get into his heart artery. We took some pictures. We noticed that one of his arteries was completely blocked. Really within 48 minutes of hitting the door to our cath lab, we were able to take care of everything. He did quite well, walked out of the hospital a couple days later.
Now they've saved 15 lives.
We treat every patient like they are our own family.
Nurse Carolyn Neese's sister, mother, and father have been that heart patient before.
These may not be my people, but they may as well be my people.
Now managing this lab, she says, is as state-of-the-art as one in any big city.
Now all we need to do is get the word out. This means everything to Ada.
In Ada, Caroline Cluess-Fletcher, News 12.